Well, thank all of you for being here. We wanted to make sure the door was locked, so we had a captive audience here. We're very excited about what we're going to describe here in a little better detail with many of the guest speakers. I want to acknowledge our friends from the treatment community for being here. We hope that the tools we're about to describe become an asset for you to use. I also want to recognize leaders in this space, Council President Sayre Nelson and Council Member Tanya, I was going to say Tanya Kim, Tanya Wu, who are here in all seriousness. Thank you for being here. We know how passionate this city council is about addressing the crisis of the day, the crisis of the hour. The fentanyl and synthetic opioid crisis, we know what it's doing. It's killing people on our streets every single day in our neighborhoods, and it demands that we have tools, cutting-edge tools at our disposal to save lives, and that's why we are here today. A few interesting statistics that we have to face head-on: that our fire department paramedics respond to more than 100 patients a week, over 400 patients per month experiencing an overdose. Last year, following the rapid rise in fatal and non-fatal overdoses, you may recall that I issued an executive order to advance a dual public health and public safety focused approach to this issue, including advancing innovative treatment solutions to help people access services. Again, that's why we are here. One of the actions in the EO was launching a post-overdose response team pilot with the goal of responding in real time to reverse overdoses downtown and around our city and rapidly connect people to treatment and recovery resources. Given the early success of Seattle Fire's Health 99 unit, we're now experiencing the expansion of this program so that the fire department paramedics can administer buprenorphine in the field and increase access to this life-saving medication. Buprenorphine, which is a word I always struggle in saying, is the generic term of the medication, and is given to patients who are treated for an overdose with naloxone. I'm not very good on my medical prescriptions. I can tell you what high blood pressure medicine is pretty easily. But in all seriousness, people are experiencing the painful opioid withdrawal symptoms. This works. This is a best practice. Buprenorphine treatment is evidence-backed and it's highly effective. Research has found that administering this medication after a non-fatal overdose reduces the risk of another overdose by 50%, 50. This program will help break the cycle of someone overdosing and then receiving Narcan and then going right back onto the streets to seek more opioids and feeling again the severe pain of withdrawal. And we know what happens when they don't have an alternative to their symptoms of withdrawal. So administering this medication in a pre-hospital setting will also reduce the strain on our emergency rooms, and we've gotten a lot of coverage on the impact on our emergency rooms because of this crisis. So once again, the early success of the Health 99 unit shows how the city is creating a supportive, cohesive, and ecosystem where people experiencing addiction can get the help that they need to recover and lead healthier lives. We believe this new program will complement our upcoming post-overdose recovery facility, which is, of course, a physical location for people to stabilize and connect with services. Again, we realize we are reacting to a much deeper-seated problem. And so this does not certainly diminish the upstream work that is indeed essential as to why a user finds themselves in this position to begin with. This allows us to save immediate lives, particularly for, again, the most vulnerable people. This is not an arrest strategy. This is indeed a treatment strategy and a humane strategy. And we're very proud of, again, the partners in this room, the partners standing with me to recognize and validate this approach. So having said that, you're going to hear from Seattle Fire Chief Harold Scoggins to speak more in depth about the pilot program. Chief Scoggins.
Well, good afternoon, everyone. My name is Harold Scoggins, the Fire Chief of the Seattle Fire Department. I also want to echo some thanks to our mayor for your ongoing support of the Seattle Fire Department and all the things that we really get out there and try to do. For our Council President Nelson, thank you for being here today. And Councilmember Wu, we really appreciate your support in being here today. You know, it's accurate to say that likely every one of our 1,000 firefighters out there has responded to an overdose. Every single one. Just let that sit with you for a second. That's how significant this challenge is we're facing. But it wasn't that wasn't the case just a few years ago. The fentanyl and synthetic opioid epidemic is challenging us as a nation. As we have all witnessed, we are seeing the impacts here locally in Seattle. Emergency responders on the front lines of this epidemic and sadly respond to overdoses on a daily basis. Let's take a look at the data. In 2021, the Seattle Fire Department responded to an average of 4.7 overdoses per day. In 2022, that number went up to 10.3 overdoses every single day. In 2023, it skyrocketed to 15.4 overdoses every single day. And so far in 2024, we are tracking at 14.2 overdoses every single day. These numbers are inclusive of all suspected drug overdoses that we face. That's a real challenge for us here in Seattle. In July of 2023, we took an intentional step in launching the Health 99 Post-Overdose Response Unit. The Health 99 unit is staffed with 2 firefighter EMTs and a caseworker that respond to provide follow-up after these overdoses. Overdose response goes out, Health 99 gets dispatched, they get on scene, the person is revived and brought back. They try to clear the scene a bit so then they can go to work. And their work is pretty significant. What they're doing is they're trying to connect with the person to talk them into getting treatment so this doesn't happen again. Because as you can imagine, we see the same people over and over and over again here in community. Our Mobile Integrated Health Program Manager will share more about the unit's progress in the first 6 months. And now we're gathered here today to announce the next major initiative by the Seattle Fire Department to help combat this opioid epidemic. In late February, after the Washington State Department of Health approval, we began a pilot program equipping our paramedics with the medicine called buprenorphine. Administering buprenorphine in the field after naloxone overdose to patients provides us an opportunity to engage patients in a conversation about treatment. It's pretty important to note. Overdose happens, naloxone is given. Now we have another tool that the person doesn't have to worry about going into withdrawals right at that moment in time because now we can give buprenorphine. And then our Health 99 team can go to work. And that work is really important. Most of these patients are transported to Harborview, to the emergency department, but they're also transported, they could be transported to the Hobson Clinic or Pathways. And that's pretty important. And like I mentioned earlier, this has just been in play for just over 3 weeks, Dr. Sayre, just over 3 weeks. That's important, but we've gotten 8 people to yes. So let me lay this out for you. 8 people to yes in less than 3 weeks. We're in service right now, Monday through Friday, from 9 to 7. So a limited response time, we've gotten 8 people to yes. 8 people to yes to say, yeah, I want to make a change. I want to make a difference. That's why this is so important for our community. Once a patient receives a dose of buprenorphine, if it's during those hours I mentioned, our Health 99 really works hard to do case management. Many times patients who have received buprenorphine, they're going to be transported to a hospital. A part of getting them to yes is getting them to the next place they need to be so now they can get connected with treatment. That's why this is so important. The idea of administering buprenorphine in the field came from studying other successful programs around the country, from our Medic One leadership, you're going to hear from Dr. Sayre in a minute, and from Health One. Our Health 99 team saw an unmet need. That's where the idea came from. It came from our Health One team. They saw an unmet need after responding to these calls day after day after day. They worked with our medical director to bring this idea to fruition, and that's what we're here announcing today. A special mention needs to go out to our Mobile Integrated Health Program Manager, John Ehrenfeld, who's here with us today. You'll hear from him. Our case manager, Riley DeHog, is here with us today. And I got to tell you, Riley has been on Health 99 every day since we launched the unit. And we have members of our Health 99 team. Lieutenant Roger Weber is here, and Lieutenant Leo Castaneda is right here. These are the members who have been riding, along with others, who have been on this unit every day. So next, I'd like to introduce Dr. Michael Sayre, the Seattle Fire Department Medical Director. Dr. Sayre.
Good afternoon. I just want to go over a little bit about how this little tiny drug, buprenorphine, works. It works by lowering the cravings that people have for more fentanyl and by preventing fentanyl from causing a person to stop breathing. Buprenorphine, also known as Suboxone, sticks very tightly to the opioid receptors inside our brains. It lasts, after 2 of these little strips, lasts 24 to 48 hours and helps to tide someone over, give them a chance to do something different. It causes just enough opioid action to prevent withdrawal. But because it sticks so tightly to those opioid receptors in the brain, it prevents fentanyl from causing any harmful effects like making someone too high or making them stop breathing. So it's protective from withdrawal and protective from overdose. It works both ways. Naloxone, or Narcan, is an excellent drug to reverse the effects of fentanyl in an overdose situation. But in an overdose reversal, patients who receive enough naloxone to kick some of the fentanyl off the opioid receptors in the brain, that works to get the patient breathing again. But when it's given in a nasal spray, it takes 5 minutes to start working, but the peak effect doesn't occur until about 20 minutes. And then it lasts only 1 to 2 hours after that nasal spray. So it wears off, person is feeling terrible, they go out, they use more fentanyl, and sometimes they die. Often, though, the patient gets too much naloxone, and then they overshoot. And when they overshoot, they're in severe opioid withdrawal, which is quite painful. We can treat that opioid withdrawal with our Health 99 team and with our paramedics by using buprenorphine. So that allows us to offer that patient something positive and engage with them. And we know that that dose lasts a lot longer than 1 to 2 hours. It lasts 24 to 48 hours to help prevent death from subsequent use of fentanyl. And that allows time for the patient to connect with additional resources, whether that's in the emergency department or in a clinic, or if they don't want to go to the hospital, to have someone come meet with them. If they do go to the emergency department, patients can get a prescription for 1 to 2 weeks of more buprenorphine before they then connect to a clinic, where they may be able to get a shot form of the drug that lasts for anywhere from 1 week to 4 weeks. So that really helps to connect them to recovery. In our initial pilot program, about 10 paramedics were trained out of our total workforce of about 60 paramedics. And our ultimate goal is to extend this through the whole fire department and train as many people as want to learn and are encountering people with overdose. Our paramedics learned how the buprenorphine works in the body. They also learned tips and strategies which were developed by the Health 99 team for how to engage with these patients successfully. Next, I'd like to turn this meeting over to Health and Human Services Director Kim. Thank you.
Well, good afternoon. I'm Tanya Kim. I'm the Director of the Human Services Department here at the City of Seattle. And I am so privileged that the Human Services Department gets to partner with Seattle Fire on this pilot because, as you heard, we will save lives. The Human Services Department has been partnering with Seattle Fire since 2011, and we've been providing response to calls related, typically in the past, traditionally with vulnerable older adults. But since 2019, the Mobile Integrated Health Program has been critical in the partnership not only across the city, but across the city, extending into the community with our service providers and the county. We're the connective tissue in some of that space, and so it's so important that we're partnering with our colleagues, and some of them, again, are present here today. On that note, with Health One, we've been able to, as you heard multiple times, respond to the client's needs immediately, but post follow-up. The connective tissue is where then we can do the referrals for longer-term solutions to get folks into recovery or the path that they choose. With our case managers, Riley, and other colleagues from the Human Services Department, it is so important that we acknowledge the increase of substance use related calls because of the opioid crisis. And we've been able to pivot. We've been in a really good position to support this ongoing effort. With the Human Services Department, we have access also to our Aging Disability Services case managers and other resources on hand. I will say that HSD, in support of this effort, is providing immediate trauma-informed response to people experiencing the overdose, ensure that they have safe and lower risk of future overdoses. And what we're really trying to do here is prevent death. By combining immediate medical treatment with social services, again, that's our connective tissue here at the Human Services Department, we want to ensure that individuals with substance use disorder needs have the tools, various tools, and this is something that we're really proud to help bring online. And so now that I've talked about some of that bridging, we're going to take it back to Seattle Fire with John Ehrenfeld, who is a program manager.
Good afternoon. I'm John Ehrenfeld. I'm the program manager for Mobile Integrated Health at Seattle Fire. Connections and warm handoffs are the gold standard of the Health One program. Connections with our firefighters and our case managers, connections with housing providers, community health clinics, outreach workers, and in-home care. Warm handoffs to specialty teams, to social workers, to nurses and behavioral health specialists. Our ability to provide these has been the core of Health One and the secret of our success. When we started the post-overdose response team, or Health 99, last July, it was with a similar mission, to foster these connections between people experiencing opioid overdose and a network of providers and supports. So 8 months, over 250 overdoses, and more than 200 unique clients later, we have learned a tremendous amount. How best to build rapport with people as they emerge from overdose, how to understand and endorse medications for opioid use disorder, what our clients' needs are 5 minutes, an hour, or days after an overdose, what it's really like to wake up on the street surrounded by strangers. And we've also learned better how to communicate that opioid use disorder is not a moral failing or an expression of criminality, but rather a medical condition for which there are medical treatments. Sadly, we've also learned about many of the challenges that we face achieving our shared goal. Overcrowded EDs mean missed opportunities for our patients to start medications for OUD. A strained shelter system can leave them on the street. Few clinical or therapeutic locations exist that can accommodate them after an overdose. Few long-term detox or recovery beds are often available. Many first responders still need more training on substance use disorders and how to successfully engage overdose patients. Polysubstance use, homelessness, and system fragmentation work against them. With that said, though, we see glimmers of hope for building out this network. We advocated for EMS buprenorphine to start medications for opioid use disorder immediately when patients are still in the treatment window. We have that now and are seeing promising results just a few weeks in. We advocated for a dedicated space for individuals who are medically stable after an overdose, and this is on the horizon. We are expanding and strengthening our partnerships with providers at Harborview, with community health clinics, and with fellow outreach teams, building towards a true system of care. With thanks to stalwart leadership from City Hall, Council, from the Fire Department and HSD, and from our labor partners, and to our many clinical and social service colleagues, I am hopeful that this next period for Health 99 will see greater success and more clients successfully set on the road to recovery. Thank you.
Thank you, John. That was an outstanding close. Before I open it up for any questions, again, I want to thank the people out in the field doing the work. This is sometimes dangerous work, sometimes unhealthy work, but work that we have to do and we sign up for it. Thank you. The treatment providers, thank you again for doing this phenomenal work. Our partners here at Harborview and our partners with the county. who've dedicated their professional lives to this kind of work. Thank you. Thank you. We're in this together. And with that, I'll be more than happy to entertain any questions. I have my experts around me. I feel confident when I have questions with experts around me. So, are there any questions? And if not, I'm going to count us down to 3, 2, 1, Seattle. Thank you very much.